Hello, my name is Karen Croft, and my DMP Quality Improvement Project was to implement a mentorship program for new nurses that were hired during a pandemic. In an acute care facility located in the Midwestern United States, the registered nurse with 1 year or less experience working in a medical and surgical unit's turnover rate has risen to 40%, which is 23% higher than the overall medical and surgical unit RN turnover national average. This project is important because the inability to retain RNs in medical and surgical units has resulted in the use of agency RNs and continual need to hire nurses, causing a financial impact of approximately $2 million for the agency staff and approximately $62,000 to hire each new nurse, depriving the organization resources to focus on improving patient care. The purpose of this project was to utilize the executive nurse administrator competencies to implement an evidence-based mentorship program over a 12-week period for registered nurses with less than 1 year experience that are hired into medical and surgical units during a pandemic with a long-term goal to reduce turnover rates. The aim for the project is to put the facility in the position to reduce nursing turnover by 5% in 6 months. The project occurred on 8 medical surgical units in a 300-bed not-for-profit community hospital. The program was structured using the Academy of Medical Surgical Nurses mentoring program. The program offers guides for a site coordinator, mentors, and mentees. The guides include tools to assist with mentor-mentee meeting planning, impacting the mentee's intent to stay in their position, and measuring the mentor and mentee program and job satisfaction. The mentor and mentee pairs were grouped in Group 1, 2, and 3. Group 1 was May of 2020 with 3 pair. Group 2 was June of 2020 with 3 pair. And then Group 3 was in July of 2020 with 5 pair of mentor and mentees. 4 measures were used to evaluate the effectiveness of the program: an intent to stay survey, job satisfaction scale, the mentor program satisfaction survey, and the mentee program satisfaction survey. The intent to stay survey has 15 questions measured on a 7-point Likert scale, 1 being strongly disagree to 7 being strongly agree. The job satisfaction scale has 26 items measuring the degree of satisfaction on a 5-point Likert scale. The Mentor Program Satisfaction Survey has 9 questions measuring the degree of satisfaction on a 5-point Likert scale, 1 being little to 5 much satisfaction. The Mentee Program Satisfaction Survey has 12 questions measuring the degree of satisfaction on a Likert scale of 1 to 5, 1 being little to 5 much satisfaction, regarding professional and personal development, communication with others on the healthcare team, and working with the mentor. The Academy allows users to edit tools and guides to meet the needs of their organization. However, no changes were made to any tools or survey for this implementation. Mentors and mentees completed the surveys at month 3 post-hire. At 3 months, mentees' mean program satisfaction scores were trending slightly higher than previously reported means for the same period. Intent to stay is slightly lower than previously reported data, while the current mentee's job satisfaction was trending higher compared to previously reported results. The initial trends are encouraging when considering the influence of the pandemic on frontline nurses and their work setting. According to the local Board of Nursing, there were 4,000 to 5,000 students who would complete their nursing education during the pandemic due to testing sites being closed, these graduates would not be able to enter the workforce. Therefore, the Board of Nursing temporarily suspended the rule requiring licensure by passing the National Council of State Boards of Nursing licensure exam for RNs. New graduates were granted a license for a defined period, provided that a background check and evidence of nursing education program completion was submitted. In May 2020, the organization was able to hire 3 RNs into the medical surgical units under this rule. These 3 nurses entered the healthcare organization during a pandemic response with a non-traditional completion of their nursing program. Developing a connection with these mentees was vital to socialize them into the work environment and to impact these mentees' intent to stay and job satisfaction. When the project was being planned, the facility had 8 functioning medical surgical units. As a result of the pandemic, the inpatient census dropped dramatically and 3 of the units were closed. The staff were temporarily reassigned to other units. After 10 weeks, 2 of the units had reopened. 1 of the units would not reopen as a medical and surgical unit. All staff from the permanently closed unit were reassigned to another unit. However, one original mentor-mentee pair did not get reassigned to the same unit, resulting in reassigning one of the new RNs with a new mentor. Early research has identified the risk of post-traumatic stress disorder for frontline nurses caring for patients has increased from 6% before the pandemic to 62% after caring for patients during the pandemic with patients positive for COVID-19. The need to better understand how to prevent long-term risk for frontline nurses is evolving. Matching newly hired nurses with a mentor is a first step toward developing a support system. The sustainability plan for the mentorship program entailed each medical surgical unit manager assuming the responsibilities of the site coordinator for their respective unit. Mentoring is designed to foster relationship building by providing a supportive and nurturing environment. The Director of Acute Care Services assumed the responsibility to hold each manager accountable to continue the program and to continue data collection as directed in the mentorship program. The limitations of this project included being implemented at one community hospital, only being implemented on medical and surgical units, and having a small number of participants. A larger scale project using the same mentoring program could be implemented at a large healthcare organization in many types of nursing departments to determine the impact of new nurses' intent to stay and job satisfaction, and ultimately determine how implementing a mentorship program impacts RN turnover. The findings from the mentoring program surveys provide insight for nursing leaders to use an evidence-based mentoring program in their organization. Retention of nurses in medical and surgical units is a challenge that nursing leaders face nationwide. While nurse retention being such a complex concept, following an evidence-based approach to address the factors that affect nurse retention is critical to secure staffing to provide high-quality care and meet the needs of the organization and their community. Developing supportive relationships early in nurses' careers can affect their intent to stay and ultimately the RN turnover rate.